Assalamualaikum. My name is Hazid Nafar bin Hamidi, and let me introduce my group member.
Hi, my name is Muazzin bin Muhammad Marzuki.
Hi, my name is Ashfahan bin Abdul Azri.
Hi, my name is Muhammad Zafin bin Rafai.
Hi, my name is Muhammad Shamil Ilhan bin Sarahan.
Hi, my name is Adam Haikal bin Omar.
The National Anti-Drug Agency of Malaysia, AADK, is a government agency dedicated to tackling drug-related issues in Malaysia. Established under the Ministry of Home Affairs, the agency primarily aims to mitigate drug abuse and its accompanying social and economic consequences through strategies focused on prevention, rehabilitation and enforcement. AADK operates in accordance with the Dangerous Drugs Act of 1952, the Drug Dependence Treatment and Rehabilitation Act of 1983, and related legislation. These laws empower the agency to detain and rehabilitate drug users as well as to prosecute individuals engaged in drug-related criminal activities.
Let me begin by discussing the concept of planning. Fundamentally, planning is about setting objectives, determining the steps to achieve them, and maintaining coordination throughout the process. For AADK, planning is much more than just a formal process. It is the cornerstone of their missions to create a drug-free Malaysia. AADK divides its broad vision into smaller, actionable steps to make sure that every entity, tool, and resource contributes to the larger goal of addressing drug abuse effectively. Now, let's talk about the Strategic Plan 2021 until 2025 developed by the National Anti-Drug Agency AADK. This strategic plan was formulated to address the growing issue of drug abuse in Malaysia, and it presents a clear and detailed roadmap for tackling this complex problem. The plan goes beyond offering the short-term solutions, focusing instead on holistic and long-term transformations by combining immediate action with long-term strategies. The plan ensures that the response to the drug abuse is comprehensive and sustainable. This approach ensures that AADK efforts are organized and impactful. Instead of tackling isolated issues, each action aligns with the overall strategy to achieve a lasting solutions by separating their visions into clear and double actions. AADK guarantees that every part of their plan is significant and contributes to the bolder goal of fighting drug abuse in Malaysia. Moving to the long-term visions, the main goal of AADK is to create a drug-free Malaysia. To achieve this, the agency has set a bold short-term and long-term objectives. Let's look at this in more detail. Short-term goals. In the short term, AADK is focusing on addressing the immediate challenges posed by the drug abuse. The first priority is increase public awareness throughout the campaigns that educate the public about the risk of drug abuse and guide them towards making better decisions. Another priority is improving access to rehabilitation programs so individuals can get the help they need to overcome addictions. Additionally, AADK is working on strengthening enforcement teams to effectively target drug trafficking and reduce the supply of illegal drugs in Malaysia. These actions aim to produce quick and tangible benefits and address the urgent issues. Now, long-term goals. In the long term, AADK is committed to achieving the permanent change. The agency plans to integrate the drug prevention education into a school curriculums to educate the younger generations to the dangers of drug use from earlier age. AADK is also looking to expand recovery initiatives to ensure the continued support for individuals after treatment. Moreover, the agency is working to strengthen international cooperation to combat the cross-border drug trafficking and adopt global best practices. The long-term efforts will create a foundation for the sustained success in reducing drug abuse across Malaysia. Now, the success of such a comprehensive plan relies on collaborations. AADK works with the various stakeholders including governments, agencies, NGO, community groups, and medical professionals. Each of these groups provides a valuable resources and expertise to ensure that AADK plans are effective and inclusive. Moreover, AADK is also cooperating with international organizations to align its policies with the global standards and exchange knowledge on the most effective anti-drug strategies. The 5-year time frame from 2021 to 2025 ensures that the planning is structured and measurable. The goals and actions are broken down into the annual milestone, making it possible to track progress and make necessary adjustments along the way. By combining strategic planning, strong collaborations, and well-defined timeline, ADK is creating a clear path toward a drug-free Malaysia.
Managing the issues by organizing. AADK is integral in managing drug issues in Malaysia, working through coordinated plans that include community participation, law enforcement, rehabilitation, and prevention. By having a strategic and organized approach, the agency ensures that resources and operations are used effectively to tackle drug-related challenges. Okay, now we move to how the ministry organized to address the issue. The Ministry of Home Affairs, KDN, oversees drug-related issues and employs a comprehensive strategies to combat drug misuse and trafficking. This includes a strategic planning, development of long-term policies such as the National Anti-Drug Policy. Now, the concept and importance of organizing. Organizing is defined as coordinating activities and resources to achieve specific goals. It is vital for business, governments, and organizations to function smoothly. Okay. Work specialization. AADK officers specialize in law enforcement, rehabilitation, or prevention. Departmentalization. NADA has division for field operation, research, and policy. Authority. Director General leads regional directors manage state operation. Centralization. Decision making is concentrated at the top level of the organization, which the Director General and senior leadership responsible for key decisions at the federal level. Decentralization. While most decisions are centralized, there is some decentralization at the state and district levels. Regional managers and district officers have the flexibility to adapt programs to local needs. Chain of command. This refers to hierarchy within the organization. The Director General is at the top, followed by regional directors and various officers. Span of control. This concept refers to the number of subordinates a manager oversees. The span can be narrow at the executive level and wide at operational levels. The degree to which the organization adheres to standardized rules and procedures. AADK follows strict guidelines for drug prevention campaign and other activity to ensure consistency and accountability. Challenges of formalization. Although formalization brings efficiency, it can slow down decision making in emergencies. To address this, AADK gives local office some discretion to adapt programs based on community-specific needs.
What is controlling? A key managerial function to ensure actions align with established goals includes checking, regulating, verifying, adjusting organizational processes, ensures effective and efficient use of resources to achieve objectives, reduce future errors through preventive measures. And the importance of controlling. AADK's roles to address drug-related issues in Malaysia under the Ministry of Home Affairs, such as manages law enforcement, public security, social management, and more, to ensure the agency objectives are met and corrective actions are taken when necessary. Enhance the employee motivation and performance to meet set goals, and to reduce drug addiction and improve public health outcomes. And the controlling strategy and steps of decision making, the structured approach to enhance the effectiveness and
drug prevention and rehabilitation programs. Involves setting standards, measuring performance, evaluating results, and taking corrective actions. And the establishing standards are setting clear goals. Standards are set for programs like rehabilitation, awareness, campaigns, and prevention. For example, rehabilitation, their target are to recovery rates and patient certification. And doing a sum of awareness campaigns such as risk-specific audience. For example, youth education on drug dangers. And measuring performance are collect data to evaluate program effectiveness. For example, track the number of successful rehabilitation cases and measure the impact of awareness campaigns through surveys and feedback. And then comparing performance with standards. Compare actual performance against established targets. For example, rehabilitation, compare actual recovery rate with the target of 75%. And the target of awareness campaigns, assess with the if the target audience, for example, 10,000 individuals was reached. And the last one, taking corrective actions. If performance doesn't meet the expectations, corrective actions are taken. For example, rehabilitation, they are introduced personalized counseling or additional support services. Awareness campaigns, to modify outreach strategies or collaborate more with schools and communities.
Definition of decision making: picking the best way to solve a problem or reach a goal. For NADA, it supports their mission to fight drug abuse and create a drug-free Malaysia. Significance of decision making: help NADA use resources like money and staff effectively. Focus effort on key areas such as prevention program and rehabilitation center. Every decision, running campaign or improving service, reduce drug abuse. Type of decision making: routine decision handle simple everyday tasks like planning campaign or setting budget. Complex decision require creative thinking to solve an unexpected problem like dealing with a sudden rise in drug abuse. Condition of decision making: certainty, straightforward decision with predictable outcome. Example, renewing funding for a successful program. Uncertainty, decision with unknown outcome but estimable risk. Example, introducing a new rehabilitation program. Group decision making, encourage diverse idea and expertise, leading to a better solution. Share responsibility for a decision. Challenge including disagreement or dominance by individual causing delay. Challenge in decision making: incomplete or outdated data make planning harder. Conflicting priorities among team complicated decision. Limited budget and staff require tough choice about focus area.
In conclusion, the National Anti-Drug Agency of Malaysia, NADA, plays a crucial role in addressing drug abuse through prevention, rehabilitation, and enforcement guided by the Dangerous Drugs Act 1952. Its strategic plan 2021 until 2025 focuses on both immediate and long-term solutions, promoting public awareness, strengthening rehabilitation, and improving enforcement. The agency emphasizes collaboration, specialization, and localized strategies while continuously evaluating and adapting its effort to ensure progress toward a drug-free Malaysia. In sum, NADA's organized approach and ongoing improvements aim to reduce drug abuse and promote a healthier society.